let's discuss the genital ulcers. Genital ulcers may be single or multiple. If the genital ulcer is single, then again you look into whether it is painless genital ulcer or painful genital ulcer. If the genital ulcer is single and painless, then this is because of the syphilis. If the genital ulcer is single and is painful, then this is because of the Haemophilus ulceri. Or more accurately, we can say if the genital ulcer started as single and is painful, then this is because of the Haemophilus ulceri. Because later the infection of the Haemophilus ulceri or the lesion of Haemophilus ulceri may convert into multiple genital ulcer, but initially it started as single. If the genital ulcers are multiple, then again you need to look whether they are painless or painful. If they are painless and multiple, then this is because of the human papilloma virus 6 and 11. But if the genital ulcers are multiple and are painful, then this is because of the herpes simplex virus and most often due to HSV2. Now let's look into the pictures of the single genital ulcer. If this is a single genital ulcer and is painless, then this is because of the syphilis. But if the genital ulcer is single and is painful, or initially single and is painful, then this is because of the Haemophilus ulceri. Here you can see that here are multiple genital ulcers. That's because initially it started as single genital ulcer, but later on it is converted into the multiple genital ulcers. Initially single and painful, so this is Haemophilus ulceri. Later it may convert into the multiple painful genital ulcers. Now let's discuss the multiple genital ulcers. If the multiple genital ulcers are painless, then this is because of the human papilloma virus 6 and 11. If the multiple genital ulcers are painful, then this is because of the HSV2. So let's summarize all these in this slide. Genital ulcers in male and female, that is if it is single, and painless ulcer, then this is syphilis. Syphilis is painless chancre. If the ulcers are multiple, painful, and start as vesicles, as you can see over here, these are vesicles. So if they start as vesicles and they have the additional symptoms of dysuria, that is painful micturition, also may have the flu-like symptoms. These are very important because in some scenarios they may give the multiple painful ulcers or lesions, and they will give a clue of dysuria or flu-like symptoms. So you need to remember that this is because of the herpes simplex virus, most often due to type 2, that is the genital herpes. In genital herpes, we give acyclovir. If the genital ulcer is a single lesion and is painful, initially it is single, but later on it may become ulcers, that is, it may convert into multiple ulcers, and this is because of the Haemophilus ulceri, that is the chancroid. You can remember, I do cry from pain and being single, that is, it will be painful and started as single. This is important that in Haemophilus ulceri, the ulcer started as single, that is single chancre, which is single erythematous inflamed papule or patch, but there will be no vesicles as in herpes simplex virus. If the lesions are multiple, painless, and are cauliflower shaped, then this is because of the human papilloma virus 6 and 11.